being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect public health, safety, and welfare in the light of the coronavirus.
Second.
We'll need to do a roll call vote.
Commissioner Blair?
Yes.
Commissioner Cook? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Before we go any further, I would like for us just to briefly take a moment of silence in honor of Commissioner Irvin. He was a well-respected member of this committee, and we will definitely miss him. None of us had any idea that when we saw him last month, that'd be the last time we'd see him. So if you all don't mind, I would appreciate if we could just take a moment for him. Very good, thank you. All right, our first order of business then is to approve the minutes for last month's meeting.
Madam Chairman, I find the minutes in order and without objection. I move for their approval.
Thank you. Second, Ms. Cook. Awesome. Call the roll.
Commissioner Blair?
Yes.
Commissioner Cook? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. All right. Up for the much anticipated and awaited Dana Garrett for the Health Department report.
Okay. I bring to you first our March numbers for the clinics in Murfreesboro and Smyrna. So we are operating under a continuing operation plan. So we're not offering all services, but we are able to do a lot of our services. So we've removed a lot of barriers for WIC, the federal government as well as the state government. And we can do that over the phone with clients and do their education that way. And actually, it's been very popular. We increased our numbers several hundred in both sites compared to what it was this time last year at this month. So I think that is a popular thing that the patients enjoy, being able to do that over the phone instead of having to come in. We also are doing family planning and primary care visits over the phone and telehealth with some of our clients. We're still doing birth certificates and death certificates, immunizations and childhood physicals are still getting done. The health inspectors are not doing as many restaurant inspections as more. They're doing tons of consultations with the restaurants on the phone, advising them and giving them guidance through all these changes and things that are happening. So as you can see under the complaint, we didn't really have a consultation tab before. We just kind of added, we're not really getting that many complaints. It's much more about people calling and asking for guidance. So you can see that was for March, 774, in April. I'm sure that will be even more there that we see. And just I thought I would go over, so that's pretty much our usual monthly report of our protect, promote, improve categories of what we're offering at both sites. Most of our team that would normally be out doing health education events in the high schools or diabetes classes at churches and that are really helping us with our COVID-19 response. And there's tons to do that involved with the process behind the scenes that a lot of people don't see, with contact tracing, calling positives, talking to all the people they've been in contact, and then calling all those people and talking to all those people who've been in contact, advising and doing that. So we have a bunch of our staff, pretty much it's all hands on board Every staff member is needed to pull this off. And then we're testing daily at the health department site in Murfreesboro. And Monday through Friday, it's free. There's no restrictions, so you don't have to have any kind of symptoms. And we just ask that people give us a call first so we can kind of tell you a good time so you don't have to wait long. You can pull in, we come out to the car, and we do the testing there for you. Yes, the phone number is 898-7880, 898-7880. And if you'll just call us, we will answer any of your questions you have. We're taking about 200 to 300 calls on COVID a day at the health department. We have some of the school nurses have come in to help us answer some of those phone calls and to call people with their results. When you are tested at the health department, we call you Monday through 7 days a week. We will call you with your results. So I have teams coming in on Saturday and Sunday and are calling people with their results, so you don't have to wait. Whether it's negative or positive, we're calling everybody to make sure they get what they need on that. It sometimes varies, but I would say to be safe, 5 days. Sometimes we get them back much quicker than that. But I tell people, let's just plan on 5 days in case there's a big backlog that happens or something happens with the process. But we've been seeing them 48 to 72 hours coming back. But I tell people just 5 days, give us to make sure. Yes, sir.
For April, are you going to add either a separate block or under communicable diseases, a COVID?
Yes, we can. We absolutely can. It's almost a blur. Like, I can't believe it's April. You know, like March and April just seem to be a blur. And so I thought about that when I was sitting over there for a minute and thought, well, I'll add that in to the report. And just some of the high categories, number of tests and, number of phone calls and that kind of thing. So as an example, last week we did 1,200 tests Monday through Friday at the health department. So it's a lot. We're testing a lot. As of today, we have about 246 in our county that are active cases, 434 total, 188 of those are recovered. And we've tested about 4,500. And I don't just mean the health department, I mean the entire community, because we have many partners who are testing. Primary care doctors are testing their patients. Murfreesboro Medical Clinic are testing patients. We have some partnerships with Kroger mini walk-in clinics that are doing some drive-through. So lots of people doing testing.
What is the number of people being hospitalized compared to the number of people that, would you say 4,400 have been tested?
Yeah.
How many
Some
of those
45.
have
Yeah. I don't have a per se number. I know that I talk to the hospitals daily about their numbers, and I know on average it's been pretty low. So I talked to both of them, I want to say Monday, today's Tuesday. I talked to them on Monday, and they had a very low census of patients with COVID. So I know that they published that, and I can get you that and add it on the list for the report next month that will show what kind of hospital beds. I think they had 80 beds open, which is pretty good. And then they'll be transitioning into doing some different surgeries and things they haven't been doing for a while, so that may change their bed number availability soon.
Did you want to mention the testing this Saturday and kind of how the state plan is sort of a kind of a rolling test among health departments?
Yes, thank you for reminding me. So on Saturdays and Sundays, the state has been kind of spreading out where we do in the Middle Tennessee area, spreading out where we offer drive-through testing. So if you'll remember, 2 Saturdays ago on the 18th, we had it at the Murfreesboro site. And then again this Saturday, we will have it on Sunday. Sumner County will be offering. So people who maybe can't come on Saturday but want Sunday. Last weekend, it was So we try to roll it around so that every county has some weekend coverage. So this Saturday, we're doing it at McKnight Park, and you will enter on the DeJarnett side. It's from 9 to noon. It's totally free and no restrictions. Same thing that we offer all throughout the week, but maybe you can't make it on the weekday. So this is something that we offer on Saturdays occasionally as the state sets these up. So we'll be doing that out at McKnight Park in Murfreesboro from 9 to noon this Saturday.
And then would you mention the Motlow, how they're partnering with the testing?
Yes, yeah. So Kroger Little Clinic, so those are the little walk-in clinics that are inside some of our Krogers here in Rutherford County. They are offering some free testing as well. They have gotten with the State Department of Health and the Town of Smyrna and Rutherford County Health Department and planned an event for this Thursday and this Friday, 10 to 4. It will be at Motlow University or College at their parking lot.
And with that
And
one, you said they
it's-
do need to have symptoms?
Yes, the only difference with their testing and they are following the guidelines of you need to have some kind of symptom to be tested. And you also have to have an appointment. You do it through a little online portal. It's really easy. I practiced it just to see, but you answer like 8 questions, and then it tells you if you qualify or not. And if you do, then it tells you what time to present to the location for testing. And then they will test you and call you with your results and then connect with me for any positives where we'll do the contact tracing and talk to the positives, interview them. And we may be able to move that and do that in other locations in the future as well with them as a partner, so.
And then I know you've been receiving a lot of community support, but did you want to mention Nissan?
Yes, yes. So several, we've just had a huge outpouring of support from community members and churches, and recently Nissan had some face shields that they had made that they donated to us. So we were super excited to get those. We need those face shields for the current testing procedure that happens. When you do test, people often cough or spit, and so you need the face shield to protect the person collecting the specimen. So we greatly appreciate Nissan and their donation.
Are there any more questions? Commissioner Phillips?
I don't know whether this is so much of a question or not, but I think Mayor Ketron is opening up the county this next Friday. That'll be about 2 weeks before the full commission meets. Is it possible to set up testing for the commissioners, like here in room 205, before that meeting at 5 o'clock or so, not only for commissioners, but for other department heads that might be attending that meeting? Is that possible, or a dumb idea, or?
Were you directing it at me or the mayor? Okay.
Not only you, but
Oh. Should I go first? You go first. Okay. So the test really is the test we have available now. We will be getting some information. The State Department of Health has told us, as medical providers in the counties across the state, we will be getting information about antibody testing and what that means and how it will go into our process. Antibody testing is a blood test that's done to see if you have antibodies against the COVID or the coronavirus 19. So when we get that information and we have some verified tests, we would be able to better know what those results mean. Right now, antibody testing, we don't know exactly what that means. So this can be a long answer to your question, but the antibody test, we don't know exactly what that means when it says you're positive. Does that mean you're immune? Does that mean you were exposed? Does it mean you're contagious now? We really are trying to, as with everything on this, the public health guidance is changing pretty quickly. I think it's the hope that that would be some place where you could utilize testing like that at a workplace or an employment place when that becomes available. We're not quite there yet. We're supposed to be getting more information through our medical alert system as medical providers very soon. When we do the swab test on people, it takes a couple of days to get the result back. That's what we have available now to test. And that tells us is at that moment, you are positive or negative. It doesn't tell us if there was, if 30 minutes later you went out and got exposed. So it almost kind of gives you a false sense of security by saying that you have a negative right then at that moment, if you haven't had any exposure or any risk. I'm fine to set up testing because we have no barriers and we have no restrictions, so we can set something up. I just don't know what it would necessarily give us as a result. What would we hope to know from that? Maybe that everybody at that moment wasn't positive or were negative, or what would be?
I'm not sure what it would say either, but I guess my thought to even ask the question was that the county will be open for business for at least a couple of weeks at that time, and would it not be a positive sign for us as county employees or elected officials to have the test and say no positives? It appears that we're at least okay at that particular point in time. Once again, it's just a thought, and it may not be a good thought, but it's a thought that
I just, and I guess it would have to be voluntary. We wouldn't be able to, we'd have to, we could offer it, but.
Mr. Gurley?
Yeah, I think that would, okay, correct me if I'm wrong, but the best I understand the test that's available now for determining whether you have COVID-19 or not, you could have been exposed 2 days before, still not showing symptoms, take the test, say day 2 after exposure, turn up negative 2 days later, but by 2 days later you would be probably running a fever 4 days after your exposure, or 5.
Yeah, it can take up to 14
and so
days
really
for
and truly, the
symptoms
way
to
the test
show
is
after
right now,
exposure.
it really wouldn't tell us anything. What you're talking about is what's used in the healthcare profession in terms of antibody tests, the titer test. I mean, as a healthcare professional, you would go take a titer test, determine whether if you're immune to
Hepatitis B or,
polio and measles and mumps and all that. That's required of every healthcare professional periodically. And right now, we're not sure. So really and truly, I don't see that it would tell us anything. It would tell us that 2 days before or 3 days, okay, so you get it back 5 days later, takes 5 days, say. So it would tell us that 5 days before you got the results back that you were negative then, but by that time you could have had it or you still might not have it. So it really, yeah, so it's really
is
not,
that way as far as.
as far as symptomless people,
Right,
if we,
right.
and
If
hopefully
you
that no
don't have
commissioner
symptoms,
would be
if-
showing up with symptoms.
Right, that's a good point, because if you do have symptoms of any kind, and they've expanded the list of what symptoms is, if you have any kind of illness, you're not feeling good, you should stay home and take precautions to keep it from spreading. So asymptomatic people being tested to say, hey, we're all negative, it's really just a picture of that day.
Chairman Allen, I apologize for bringing it up. It appears that we're going in an entirely different direction than my mind was going in, so I just ignore what I said, okay? Thank you.
I'm sorry, I was trying to answer it.
Commissioner Cook?
We had property management up here the other night, and they tested us if we come in for a fever.
Oh, yeah.
And now I was tested, every test you could give, I think, while I was in the hospital. So, I do know
Screened you, like they asked you questions and took your temperature, that kind of thing before
they
you
did.
came in.
They did.
That's
everything.
always recommended if you're going to do a group meeting, or we're going to start doing that. We already do it at the health department, but I know the county's going to do that when their their employees come back.
But to our listening audience, we've had someone here to test us as we come into these meetings.
Screen, yeah.
Screen,
Screen
yeah.
you, yes. Yeah, to screen you.
Mayor, do you have something to add?
I'll just kind of piggyback on Commissioner Phillips' comment about opening. So those who were not on the committee last night to hear what my order that went out to the employees, all employees and department heads yesterday, is that we will return to work at 8 a.m. this coming Friday. And I've been working with Chris. Now we've got over at EMA, we have 18 different buildings, 694 employees in the general fund. This excludes EMA, EMS, Sheriff's Office, jail, Health Department, because they already have scanners and they're already doing that and they have the PPEs. So Friday for our other general fund employees, they've already got the kits set up. They'll have masks that will be delivered or picked up. The department head's supposed to go by the EOC, pick up the mask for all their employees. There'll be somebody at each building. The first one on the boots on the ground at the building that morning. Like I'll take the first. I'm usually here 7:10 in the morning, and then lock the courthouse. So I'll be checking everybody's temperature. Every building will have a no-touch thermometer, hand sanitizers, and if they're over 100.4, is that correct? We send them back home. We'll give them the mask, but we're still going to be closed to the general public for at least 2 weeks. So we're not going to open up, but all of our employees will come back to work.
Are our MedPoint clinics offering the COVID testing?
I don't believe so. Well, they're not wanting to spend a lot on anything right now since they lost the contract, so.
All right, are there any more questions for Ms. Garrett? If not, I'll entertain a motion to approve her report. Commissioner Gurley, in a second.
So this is our
Dana,
grant.
hang on one second, we have to vote.
Oh, sorry,
I have to do a roll call for everything.
sorry.
Commissioner Blair?
Yes.
Commissioner Cook? Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes, thank you. You can go ahead.
Okay, so the next is the state and county contract that we have with the health department. It needed to be amended after in our budget. We have to send in our budget every year before you guys as a body vote on raises and that kind of thing. So after the raises and all that this is last or current budget year I'm talking about, we finally got it back from the state with it all amended and corrected so that it matches with what we are actually doing for our employees. So I just need to have your permission to send this forward to get it signed. Ms. Nolan has looked at it and it matches what we have. It's all reimbursable dollars that we do with the state. It's just a formality to clean it up, I guess.
Yeah, many of us who've been on Health and Ed for a while know that this is a contract that lags behind its start date, so we've come to expect this. So I'll entertain a motion.
Second. Same amount.
Commissioner Blair?
Yes.
Commissioner Cook? Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Budget is on our tablet.
The last document I have is this current year's budget request.
And again, like you said, this is all really for the most part, pass-through dollars from the state.
That one we did was, this one is the 55110, the first page is the Pure County.
Okay.
And then the next one, 55190, that's the one that is pass-through dollars from the state. And then the 55160, which is dental, is Pure County. So the first two are county contributions, and then the third one, 55190, is the pass-through dollars. So just kind of review this first 55110 with you. One of the things that we had on our request, our telephone system is barely hanging on, the system that we have, and boy, are we testing it right now. So send good thoughts that it hangs in there. But it has been needing to be transferred over to what we call the county system on their technical terms, to put some lines into our building that will actually make things a lot more efficient, will bring down our overall communication bill. That we're going to use a grant that we're going to have access to, if I understand correctly. We're going to use access to that grant for that will be coming soon to pay for those. So I see that I requested it, but the mayor didn't support it, but he's supporting it through this other grant. It just wouldn't show up in here. Did I explain that correctly, sir?
That's correct, Dana. Madam Chairman, all the counties and cities are getting grants. And so we're looking at, under special projects, getting the telephone system, and we're going to get Cody and IT to look at your phone system as well as the sheriff's phone system as well that they'd requested. And if we can pull those two phone systems out and get a better price for two under that grant we're getting from the state, then that's how we would like to spend those dollars and not put it into your budget.
Any questions about her budget? We do need to vote on this so we can advance it to the budget committee. They can review it.
Mayor Ketron, if you reviewed this, you're good with it?
Yes, sir. After I took that phone out of that, and we're going, it's a $3 million grant, so we've got some larger projects like the generator at the sheriff's department is old. They don't make the parts anymore, and I'm very, very nervous that would be the first priority under that grant. If that generator went down and it's 100 degrees or 0 degrees, it's not a good, safe environment for 900 inmates to be cold or hot. And it's a $750,000 expenditure, for a generator. They're not cheap, not that big.
Move to forward to the budget committee with a
Yes, sir.
positive recommendation.
Entertain a second.
Second.
Commissioner Blair?
Yes.
Commissioner Cook? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Before Ms. Garrett sits down, I just want to take a moment to publicly thank you for your leadership and your guidance and your level head, your calmness through all of this chaos. I know you must be working absolutely around the clock. We've exchanged a few late night text messages, and I'm sure I was just on your to-do list. So anyway, just want to really say thank you very much. We appreciate you, all that you and your staff do.
She's been a rock star, Madam Chairman.
I believe that.
Thank you. I really do appreciate it. Our team is working very hard to try to serve the citizens and get the questions answered and be there for them. So I really appreciate that. Thank you.
Great. Thank you.
Thank you.
Appreciate it. Okay, I'm not seeing a community care report on our iPad. There was no meeting in April? Okay.
Carol,
We'll take an unofficial update if you have an unofficial update you'd like to share.
I'll add some stuff too. Go ahead.
I talked to our director today, and he said we had 95 residents at community care, and so far none of our employees out there or the residents has had any virus. So I'm real proud of the way they have locked down and taken care of them. I know it's hard on the families, and we understand, but we'd rather keep you than you get sick. And so Mayor Ketron got some things to say about it.
Okay. Thank you, Commissioner and Madam Chairman. Members of the committee, there are several things real quick. I'll go through this. We were the first nursing home in the county, which there are numerous nursing homes. We have a lot. We were the first nursing facility to lock down. As soon as I heard of the first confirmed case, I told Russell to lock it down, which we did, and we've been very safe. We eliminated all family members, visitors, everybody else from coming in, and they're all safe and good and warm. We, just this past week, Russell called me, asked me if we could open our daycare center, which we have there on the premises. It's in a separate building. So we went through the procedures on that. We are only going to open it up for our employees only, not for the others, which is only about 11 of our children are employees' children. So we'll open it up for them only, so our employees can actually come back to work instead of having to stay at home and call in sick because they're having to stay home and take care of the child. So we're allowing that to come back. The food will be prepared there in the nursing home and taken out into a cart and pushed outside the door. So there's no interaction between the person in the nursing facility and the daycare center will interact. This past weekend, we had a small fire. One of our industrial washing machines caught fire, so we had yesterday and today we've been scrounging to try to find a new one. They're not cheap. An industrial with an extractor on it, it's about 15 grand. So we've between Deputy Mayor Sandlin and the maintenance director out there, we found one. They had it in a warehouse somewhere, and we're going to get it in by this coming next Friday. Steve, is that correct? Next Friday, next week. So we'll get it in. We just couldn't afford to go with only one, with an amount of linens and soiled pajamas and everything else that had to be washed. We couldn't afford that one to go down. We'd really be in trouble. So I called every board member. We got and asked for an extension or an emergency appropriation to get that in. Also, there was a vandalism last night. We were informed that somebody had shot 22 bullets through the window, and so the sheriff's department responded and found the kids who were using target practice through the window. So we found who they were. Other than that, everything's great out there.
Nothing but good news, right?
Nothing but good news. The fire was contained. Employees put it out, with some fire extinguishers. The laborious part is all the state reports that have to be filled out and sent into the state. There'll be reams and reams of what happened to the fire, how did it start, and on and on and on. How much smoke damage? Were any patients, affected, et cetera. But everything's good. Russell's happy, and I think everybody else is as well. Patients are.
That's great news that there's no COVID cases out there. That's
Knock on
fantastic.
wood.
Yeah.
Absolutely. Thank you.
We will not take a vote on that report since nothing official was submitted for the record. So we'll just move on now to the special projects report. And Ms. Nolan is going to do that for us. We've all had this for a few days. If you've got any questions, I went through it. I don't always go through it line by line, but I did this time, and there are absolutely no changes since last month.
There are very few checks that went through. I like these reports that it's not much. When it's a lot, I'll send Teresa. But no, the report is pretty much just a continuation of paying bills.
Questions for Lisa? Have a motion and a second?
Commissioner Blair?
Yes.
Commissioner Cook? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips, Chairman Allen.
Yes. Very good. Thank you. School board report.
Madam Chairman,
Yes, sir.
on the ones that have come before us before, or maybe just cleanup, is there any way to combine a few of these rather than we vote on every single one of them?
Yeah. Yeah. I actually already had that conversation with Mr. Blattery and also with Lisa Nolan. And so anything that's grouped in certain fund categories, we can do together. So we will be grouping a few of these.
My apologies, thank you.
Okay.
All right. Good afternoon, everyone. We're not going to be asking you to build any schools right now, or we're going to be asking you to fund some things. But anyway, let's get started. We'll look at our capital projects fund budget amendments. This one here was for the fiscal year 28-19 carryover projects. Normally we would have brought it in August and September, but Mr. Boldry was busy trying to fund 2 schools and make sure they were operating appropriately. All right, so we want to, all these expenditures were approved by the County Commission in fiscal year 28-19, and the capital projects were in process of being completed by June 30th, 2019. And when we closed the books for the fiscal year end, we liquidated the encumbrance somewhere to a tune of $2,978,053. This budget amendment was approved by the school board budget earlier. Motion to approve the annual capital budget amendment and rebudget for fiscal year 28-19 carryover already County Commission approved projects. Number 2, amendment to the fiscal year 19-20 approved Fund 177 Educational Project Fund. This amendment was approved and we brought it before the Board of Health and Ed last month, and it was tabled, so we're bringing it for you again. Okay, we want to take those 2 right there.
Yes, we'll take those 2 together.
All right, motion to approve the 2 amendments as presented for the Fund 177 Educational Capital Project Fund.
And again, like you said, this is no new funds. This is just simply moving funds we currently have.
Right. Okay. No funds, just the ones we currently have.
Questions? Before we... No.
Under number 2, there are some monies that are being moved around. I understand that it's all supposedly appropriated, but also there are some funds that were, I don't even know how to put this. There are some funds that were in excess.
1.5 million, I think it was.
We're moving those funds to other projects that we really didn't have planned the first of the year when all this was approved. And I'm talking about like gymnasium floors. We had those floors that we did came in under, and we're adding a couple of gymnasium floors to that, correct? Is it possible to utilize this money, in my mind, at a better place, such as Central Middle air conditioning system? Could we better utilize this money instead of building a new gymnasium floor? Could we put that toward that central project?
The answer to your question is, could it be? Yes. The floors, the gymnasium floors, every 5 to 7 years, because the floors build up with grit, they become unsafe for the children. So they begin to slip and fall, and we have broken arms and those kind of things. So there's a schedule that we have that we try and adhere to as best we can. So yes, we are picking up a couple of floors, and you are correct. The floors came in under budget that we had budgeted, and we've typically in the past, if we've had a little bit of money left, the floors that would be on the next year's request, we have picked those up, trying to stay in the same category and not ask for them the next year. So yes, we could. There is a better than average probability that if we waited a full year, in other words, not did them now, I don't have them on this year, in which I guess we could go to this year's budget and put them there, but there's a probability that we could have a child fall and get hurt. Now, I'm not saying that it's a guarantee, but the answer to your question, the short answer is yes. we could, and we have not written the purchase orders yet, it's a request. If you don't want to do those, we could take those funds and apply them to the central magnet, 1.5 million for next year. Yes, sir. That's the answer.
I guess the point I'm trying to make, and tried to go through some of this stuff the last couple of days, and I think there's 70-something or 80-something pages, and it was really difficult to do that in a short period of time, and for someone like me to make a lot of sense out of that. But the point I guess I'm trying to make is that where we are and where we'll end up come July 1st, we're still not certain. And I'm just wondering if there's ways that the school board could prioritize some of those spendings. Is it best surplus funds, projects that could be a higher priority? And once again, I'm not trying my best to be argumentative. I'm just saying, could we cut expenses in the school board's budget by doing those types of things, and maybe putting that money to where it is a higher priority?
Yeah, I think I understand what you're saying, and I think what we could do there is take that 1.5 and not do anything with it until we know what this capital project fund may look like. I think that's a pretty happy medium there. You know, in other words, that 1.5, don't use that 1.5 until we know where we are. Oh, well, I wouldn't want to do anything else but make you happy. But yeah, I think that's, I think we can meet that. I do.
Commissioner Gurley?
Yes. Having spent 27 years in state and county governments, I think the tendency is to, if we have a little bit left at the end of the year, to find a use for it. That's typical in most departments that I've been in before. This is not going to be a typical year. The reason we do that because we know that, okay, we're going to get a new budget come July 1 that's going to replenish our funds, and we can kind of start over. We can utilize what was budgeted. Hopefully we didn't budget too much, but if we had a little bit of surplus, we'll try to utilize that the best we can and go ahead and spend it without too much thought. But this year, I think we need to think that, we may not have it come July 1. So I think, if it doesn't have to be spent right now, Director Spurlock and I talked here a few weeks back. We're hoping, I don't even think in May we're going to know the effect, because the numbers that we just got this month in terms of sales tax really reflect February, and the thing didn't hit until March. So, and not even fully then. We didn't start shutting down stuff until mid-March or toward the end of March. So we're really not going to know, even with May's numbers, will be March's numbers as far as sales tax. It's probably going to be June's numbers before we're going to really know the drastic effect of this pandemic. So I really think, that really and truly, we need to be cautious. You need to be cautious on spending money, because we may not have it, and the only other way if sales tax is down, yes, some things come from sales tax, some things come from excise tax, some things come from property tax, and unfortunately, the only thing that we control is property tax. And to supplement that deficit could mean a huge property tax increase that I think a lot of the commissioners are not going to be willing to vote
I think, Commissioner, I think that's what I said. We can hold off on anything with it in that 1.5 till we know what our budget is going to look like the next fiscal year. Okay.
Okay, so we can take those two together, so I would need a motion,
Move to approve.
with the exception of the 1.5 that Mr. Spurlock has.
Basically, it's a contingency.
Right, contingent on what the fiscal year 2021 capital projects budget looks like.
Okay. Very good. So that's voting on items 1 and 2 from our agenda.
Would that contingency come back to us?
I mean, yes.
Commissioner Blair?
Yes.
Commissioner Cook? Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Okay. The next, we're going to take 3, 4, and 5 as
Okay.
one vote as well.
All right, 3, 4, and 5, we can do it. All right, we're just moving money around here. GPS budget amendment, medical and life insurance cleanup. This amendment reallocates $394,010 in already budgeted medical and life insurance dollars to major functions where it's needed after our open enrollment and new employees are in place. Number 4 is GPS budget amendment for certified staff line item cleanup for PRN nurses and payroll overage cleanup. This is money that we're just moving around. This amendment adjusts already budgeted teacher and nurse pay by moving a total of $1,108,570, with $947,020 being pay and $161,550 being related benefits. These lines were budgeted to be needed for this year. The largest part of this amendment reflects the decision to move our career and technical economic classes to be general education classes this year. Now, what that means is we normally in a CTE class, when we teach personal finance, our ratio is 1 to 20. So instead of leaving them there, we would have to have more teachers. We end up moving them into our gen ed, where a social studies teacher can teach it, or actually anyone that gets certification, and that we can go up to 1 to 35 instead of 1 to 20, which would reduce the number of teachers we need. Number 5, the state has asked, this is concerning the retirement reclassification for the hybrid, separating from the legacy. The state has asked to use the new Object Code 217 to record our employer contribution to the hybrid retirement plan for teachers and other salaried staff in TCR's hybrid plan. So what we're doing is kind of separating them there for the state. Motion to approve these 3 budget amendments as approved.
Any questions? I'll entertain a motion.
Second.
Any discussion? Do the roll call.
Commissioner Blair?
Yes.
Commissioner Cook? Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Okay, number 6.
All right, number 6 is a building program fund budget amendment. It's a proposed budget amendment for the building program fund, moves budgeted funds within the Rockville High and Rocky Fork Elementary projects in order to allocate adequate funding for whiteboards and student furniture for these school libraries. This was also done earlier back in 2013 for Stewart's Creek High and also for Brown's Chapel. The rest of the budget amendment is a small cleanup amendment that was came out of the Oakland Middle School Annex construction project. No money being asked for, just moving it around. Motion to approve proposed amendment to the building program.
Do we have a second?
Second.
Any discussion or question? Mr. Gurley?
Yeah, I think this one fits the same comments that I made before. While a lot of this stuff is nice, it may not be necessary to do what we're doing, so I think I'm not against going ahead and doing this, but I think caution should be exercised in spending this money until we know whether it's really wise to spend it, because there may be other things.
While they're discussing, Commissioner Gurley, there's one thing I will say. I had a similar concern, and so I was speaking with Ms. Nolan about this, and she reminded me that building program funds are bond money, not property tax money. And so we are a little bit more restricted on what we can use those things for. So since it was borrowed specifically for those schools and capital type improvements, that's one of the reasons we're able to use that to finish that furniture, fixture, and equipment piece. This is kind of how that would fall under for those libraries, because those libraries don't come fully outfitted.
Right, and I understand that. Electronic.
Well, it's a smart board that's connected to the computer, so it's, yeah, so it's not, they don't just write on it. They're able to connect it. The teacher can teach from it, from their computer. Okay.
You know, one of the things too, to your concern is we're talking about 1.5 million and 100,000. Okay. So, I mean, and there's a huge difference. Okay.
We have a first and a second, so we just need a vote. Is there any more discussion or questions? Okay, we're ready for the roll call.
Commissioner Blair?
Yes.
Commissioner Cook? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips? Chairman Allen?
Yes. Okay, items 7, 8, and 9 are actually have to do with next year's budget, so they're going to share that with us, review it a little bit. As you all remember, and I'll announce it again at the end, but next month is our joint meeting at the central office with the budget committee, where we all get to hear their budget in detail, line item by line item. This is your preview to that. So, Mr. Bodder? Cafeteria, yes. Yes, please.
What you have in front of you right now is the Fund 143. It's the school nutrition fund. This is right here. This is what we're reading off. And the school board approved this the other meeting they had. Yes, sir.
What's it look like?
It's not on the iPad. It was in an email that came to us, or the one that Doug sent us that I forwarded to everyone. I don't know if you had a chance.
It should be loaded.
Is it-
Was it like 8 pages?
We're doing this one first. This is just the Central Cafeteria Fund.
That's it, Lisa.
I'm sorry, it is on the tablet, yeah. Give me just a second, Doug, let's find it.
All right.
It is page 24 of 30 on your iPad.
Okay, what you have in front of you is the Fund 143, the cafeteria, centralized cafeteria fund. And that first column is the current 1920 approved budget, amended budget. And the second column is, of course, the draft 2020-2021 fiscal year budget for that fund. And of course, third column showing the increase and decreases. This is I worked with our school nutrition director to come up with a good tight budget for next fiscal year for this cafeteria fund. As you can see, there's really not much changes. Right now, the cafeterias, because we have the buildings closed for children in the buildings, we're doing online schools. Several of our cafeterias are not open. However, we have 26 of our cafeterias that are currently open and operating for emergency feeding sites. If you're 18 years old and younger, we don't care if you're a student of ours. If you're a child and you drive up or you walk up, you are fed breakfast and lunch. It's through a USDA funded program. We receive $3.50 a meal reimbursement for lunch and $2.20 for breakfast. Today, we serve over 2,000 breakfast meals and over 4,000 lunch meals in our 26 sites, and that's been pretty consistent. It's growing some, but it's pretty much plateauing off now. So we're staying, those 26 sites stay pretty busy with feeding children. If it's an adult, we will serve them, but we charge them $3.80 a meal, I believe it is, and if they would like to eat something. But that's been a pretty successful program the last few weeks while people have been out of work. Going forward this next year, one thing I want to point out to you, I know that we're going to talk more about this later, I just want to give you some highlights. You notice the equipment went down. We reduced the equipment near the bottom at $73,107 to half that price, or half that amount this year, coming fiscal year. And the reason being is because this does not have a tax levy on it. This is purely off meal charges, and it's also based on USDA reimbursements for meals. We are watching the cash flow in this fund. We're making sure that, just like a restaurant, you know, we need money on the front end before we open next year. So we are watching the money here to make sure we have adequate cash flow to open up this next fiscal year. And with that in mind, we curtailed equipment purchase. I mean, if it's not completely broke, we can't fix it. It doesn't matter how old it is, we're making do with it. And we've got the same mindset next year, so we can bring that fund balance back up. I want to talk real quick about this. One of the federal requirements for a school nutrition fund like this, it only allows the county to maintain a 25% of our operating expenditures, our budgeted annual operating expenditures, in the fund balance, in just, you know, liquid, it's cash. That's, and the thought, that's a federal requirement, and the thought behind that is, okay, once you hit that 25% of your annual operating expenditures, you need to either A, drop the meal price for the children that are paying the cost, the full cost, or you need to utilize some of that fund balance to buy additional equipment to improve you know, the nutrition department and the cafeterias. That's all well and good in a normal year, but when you're in a year like this where you have to close down, and then you're still doing emergency feeding to feed these children that need to be fed, we burn through fund balance pretty quick. So we'll be fine. I'm not trying to alarm you. We'll be fine with this, but I was looking at what other counties were doing with their school nutrition program, and what I was seeing was people were giving, you know, they were doing all sorts of things with school nutrition, and I was sitting there thinking, now how are they able to do this when they're under the same federal requirement as I am with, you know, keeping that fund balance no more than a quarter of budgeted expenditure for the year? Well, I got to looking at their audited numbers, and some of them had 120% of their expenditure in fund balance. So some of them were ignoring that. Well, obviously we follow rules in Rutherford County. We try to. And my point with this is that's something that really needs to be revisited in the future. Talking to the federal, you know, when we talk about to congressmen and folks, to say, hey, that needs to be reconsidered, that we can keep up to half of fund balance, you know, or I'm sorry, half of annual expenditures in our fund balance in that fund. Since there's not a tax levy, we have to make sure that it's ready to go for the next year, which means we're having to spend cash on the front end like a restaurant to open it. So I just wanted to make that point that's just something that's come to light this year because of these unique situations with needing cash flow when you don't have the revenue coming in like you normally do. But once again, this is a pretty status quo budget for this fund. One item we put in there was the electronic timekeeping. We're looking at going on the school, part of the school board strategic plan was to bring our classified hourly employees onto electronic timekeeping like the county's been on. We've been looking at the same system that the county departments are on, Gory Reagan. They'll be able to track labor more efficiently. And, excuse me, I think that'd be a good internal control for us to have. But that, in a nutshell, is the 143 fund. Do you have any questions on that? Pretty basic fund.
Did you have a reduction in staff? Because you've got a pretty sizable decrease on the supervisor director line.
That was our,
One going out was on a 120 contract.
yes. We have two people in that line item, and a third one that had, like Mr. Brock said, was on 120, and he dropped off to retire. We have around 300 part-time and 100 full-time in this fund personnel.
Kind of repeat myself and ask the same question. With the schools being closed, I know the cafeterias are still operating, just like you explained, and Doug, and I commend you guys for doing that. It's a need, and that you're helping meet the need of the county by doing that. But the time that we're closed, I can't remember exactly when it was, sometime mid-March through 1st of June normally. Are your expenses going to be what you had budgeted, or is there going to be some funds left there?
If it's not needed, I went and sat down with the nutrition director, and if it's not needed, for example, a lot of, when you get into days like this, just like a family that, we got families that are right now on unemployment, and they're not laid off, they're furloughed. And just like a family would say, hey, we're not going to go out to eat, we're going to eat out of the refrigerator and the freezer. Well, our cafeterias have used a lot of the freezer food in order to make these meals that we're doing now. So to answer your question, yeah, we have dropped back on a lot of having to buy fresh things. We've used a lot of stuff out of the freezer that way we just use what we've got on hand, because even though that's a lot of meals, 6,000 a day, that's a whole lot less than we'd normally be selling or serving if it's USDA.
So there's going to be funds left in that account.
Based on estimates and what I'm tracking and watching, yes.
What's the plan for those funds?
The 3 months federal. The plans for the funds, excuse me, that's left over, it'll roll over forward in this because if it's generated in this cafeteria fund, it has to stay there.
Can't go anywhere else?
Yes, sir. And then it goes forward to our next year. And like I was saying, just like a restaurant, you start spending money before you even start up the next year. We'll do the same thing.
But in essence, we'll be able to save money from next year's budget request from rolling that over, correct?
Correct.
Thank you.
Correct.
Doug, the one footnote I want to make to that is, though, by being closed, though, you're losing those students who pay full price for the lunch, which also subsidizes this fund, correct? So you're going to be down in revenue because your students who would normally pay for their lunch won't be paying in, so.
I'm taking that into account when I'm running, look at my cash flow right now for the rest of the fiscal year.
Mr. Gurley?
Yeah, so really and truly, we're going to probably, do you know what percentage roughly, just roughly, or fall into where we're feeding them? And okay, so we're continuing to feed 45% of our student population, but the other 55% that we would normally get revenue from are not contributing revenue into this fund. So bottom line is, Commissioner Phillips and I both wish we had had a lot of revenue left in this fund, but bottom line is we're probably just going to kind of break even, right?
That's my goal.
And that's what you hope, right?
Yes, sir.
We don't have to.
And that's what my efforts are right now to do.
Yeah,
Correct.
just to break even.
Mm-hmm.
We didn't get for lunch.
Yeah.
350 for the lunch and 220 for the
So
breakfast.
we count on a lot of a la carte, those that pay, and it's like the Commissioner said there, it's going to have an impact.
So if we break even, so I'm not really expecting a big slush fund at the end of this. I think if you break even, you'll probably be doing well because you're losing revenue. You're not spending as much, but you're still losing. So.
Okay. The next fund we'll look at is the Capital Project Fund, Education Capital Project Fund 177. And what I'm looking at right now is just the operating statement before we go into the next, right after this, of course, is the detail of the capital projects requested.
Yeah, this is page 25 on your iPad.
Thank you. Just briefly, walking down this, and I know that what a penny brings has increased slightly since this estimate that I used for the revenue, but in a nutshell, that is what the school board has approved and put before you is for consideration is the 7.5 cent revenue that was appropriated this fund for the current fiscal year, and we have matched that, what we're requesting for capital improvements for what that revenue would bring this year for the same amount, 7.5 cents. I know Mr. Lee is going to come forward and explain in detail the capital projects that are requested. Out of this $7,323,066 that would be budgeted in this proposed capital project fund budget. But once again, I guess he's talked before about our needs out there for the backlog of capital improvements. But what we have put before you is just the 7.5 cents that was provided by the county commission this current fiscal year. Yes, sir.
We increased this last year.
That's correct.
Because
about the
we
2
were
cents.
presented with overwhelming, I thought, evidence that we needed to increase this because the capital projects are behind. I can't say till we get numbers that we can maintain this, but I would hope that we can maintain this at the same level, because even if we maintain it at the same level, we're still going to be behind in terms of capital projects. I think the best we can say is that we're probably not going to be increasing this again this year. That's up to 20 other people, but I will argue to maintain it if we can.
Yes, please.
And let me reiterate what Commissioner Gurley's saying. We have to present a budget, and we have to start somewhere. And we started with where we were last year. And to Commissioner Phillips's comment earlier, we've taken this large number and I've pared it down as best we prioritized. We've gone from basically 80 some odd million to 7.3 million. Sooner or later, in the next few months, this body's going to tell us what you can fund. You're going to say it's 7.3, like Commissioner Curley said. You may came back to us, which we hope, but none of us know just yet that it could be 5 million. You could come back and say, we've got a one-time thing, we're going to have to cut it to 4. And when you tell us what that number is, then I'm going to take what you see tonight and what we will discuss next time at 7.3. I'm going to take a very sharp knife and I'm going to reprioritize those items to whatever number this body tells us. So what we're showing you here tonight and what we are going to discuss in the coming weeks and months this is a starting point. And we understand that, but we have to start with a number so that what you will see is this is from 80 some odd million to 7.3, this is our priority. And when you tell us what that number is that you can fund, you'll see the items on this priority that go away. In this number, they were the least of the worst. I don't have another way of putting it. So I say all that to say this, the $1.5 million that you discussed earlier, which is central magnet, is in this budget. And we're in a holding pattern. I would say that $1.5 million would be one of those high priority items. The other ones, the roofing, there's some roofing items that I would put way up there because if it's leaking, we're going to damage the building, we can't have class. So I would say that. And then one other item, there's another big item at $1.5 million, and that's the Buchanan sewer system. We have our own standalone sewer system that pumps to the river. Our permit for that sewer system runs out in 2021. That system, unfortunately, is 20 some odd years old, and we're spending somewhere between $3,000 and $5,000 a month to keep it operational. That's just to keep it running. That's not chemicals, that's what it's taking to keep it running. This 1.5 gets us off that system and ties us into the city sewer. So I want you guys to look through this, and then we'll be up for discussion. I'm not going to go line item by line item tonight. I just wanted to bring a couple of items up. This is a starting point, and we're all going to have to work together, and we're going to do the best we can, and that's what we're going to do. So after that, I'll answer any questions.
I don't know if this is a question, Madam Chairman, but the way me as a commissioner has looked at this for 30 some odd years is that the school board presents a request and it's up to the commission to fund it. Right now that role may be reversed. It's up to the commission to look at ways for cutting that, and all you guys can do to help us do that is going to be, I can't tell you how much this commissioner would appreciate that. So what you just said is exactly what this commissioner has been looking for, and thank you for doing that.
Thank you.
Hey, I do have one question. There's a line item in here for an additional portable. I don't know if that's multiple or one. It's 102,000. Two portables. We've not had to spend money on portables in a while, so this is, it gave me a little heartburn when I read it.
Not palatable on our side of the street either.
Yeah. Just grasping at straws. Yeah. Okay. Okay.
Okay, now we're going to kind of look at the proposed GPS budget. It's the one that's detailed. And what I'm going to kind of do is kind of go through some of the highlights on it, looking at things that kind of stick out. If I don't know some of these object codes in terms of what's all in there, I'm going to ask this gentleman to my right. All right.
Mr. Sperlich, wait 1 second. This is on your iPad. It's labeled Fund 141 Detail.
Yeah, detail.
All right, go ahead.
No, we're going to go through the detailed. I think that's more telling there. That one, that kind of provides a breakdown on things.
Are you doing the summary of the detail, or you're doing the?
I'm going to go through each one of the functions and look at some of the. I'm going to look at the ones that kind of the increases and the decreases and that are probably outliers.
Madam Chairman, what if we just went through the summarized by object code, and then if we've got questions, go into details?
That's fine.
He's talking about the one that's 8 pages.
I think you'll get more out of it if we go through the summarize, and then you can kind of go back and look at the.
All right, thank you.
All right, on the 71-100 regular education program, elementary and secondary, the first one that jumps out is the teacher regular ed. You'll notice 68 there. However, that's not a true number. If you'll look on 72, let's see, 72-210. 72-10, that would be, I mean, am I right on that? 72-210, yeah. 72-210, and that would be, let me get to there, that's page 10. 72,210. All right, that would be, if you'll look at that, look at 138 there. It says instructional computer personnel. Those were actually called technology coaches. There's 36 of those. Those technology coaches are going to be moved from that line item and will be going into that 68, which means we're actually going to build in 32 positions for growth. And keep in mind, we added over 1,040 this year, so we anticipate just as many in the coming year. Okay. All right, moving on down. We already talked about the hybrid, so we should understand that one in line item 217. Looking at the 312 on that first page, 42.2%, that's the increase in our homebound services of the students. Okay? And then the next one there is 336, maintenance and repair of service equipment. You notice that large number, 777.8. If you'll go down to the bottom of that page at 722, all right, this is where we used to replace our band equipment, instructional equipment. Well, what we figured out is we can save more money by just simply having them serviced, and maybe they'll last a bit longer. So that's the reason why you see this line item increased here from 4,500 to 39,500. But at the same time, you'll notice that we're reducing that budget for new instruments from $2,989,151. We're reducing that by 1.858131. All right, another thing on that same page, on Object Code 449 textbooks, this was an adoption year. We did adopt our English text. However, the math adoption was put off for another year, so that's being reduced by 27.2%. 499 Object Code, you'll notice that's 82% decrease. The reason why is we are not opening up new schools. We opened up Rocky Fork Elementary and Rockvale this past year. All right, the 599, this is for driver's ed and activity bus. Nissan got out of the business, and we have to purchase for our driver's ed and replace those and activity buses. All right, moving over to the next page. Once again, one that jumps out is the instructional supply and supply and material. It's 11.3% increase. This is due to the increase of instructional materials that we're providing, and also including the new schools that we opened up. Okay, moving to the next page. Object Code 71200, Special Education Programs, Elementary and Secondary. We're adding 5 positions to teacher special ed teachers. That will give you, when you add that to your 68 and you go back and look at the detailed one, that'll give you your 73 that you're looking at on that other sheet. Moving on down, educational assistants, we did have an increase there by 3.9%. A lot of these we talked about, I think last year, a lot of our students that have come to us have what's called ancillary aids, which is one-to-one. We keep track of that, and we have reduced it, but we get more and more that need this. All right, the next one is the 322, line item 322, evaluation and testing. Increase of 205.9%. This is because of all the various battery of testing and assessment, cognitive and also other areas, emotional and testing. The next one is 429. This is the instructional supply material, increased by 45.5%. This is an additional instructional material that we have to provide for our special ed, most at-risk students. All right, moving to the next page. Okay, that's just a summary of the 71200. You can see the budget increase 4.5%. Our next is career and technical education, 71,300. You look at the first one, you see the teachers and vocational. That kind of takes into what we just talked about earlier. Moving on down to 448. This is Tni Construction Materials. We are adding 10 new programs throughout the county in our career and technical education program. We actually have 2 that are going to be in the northern end of the county. They're called mechanical, electrical, and plumbing programs. They'll be in Laverne High School and at Smyrna High School. The total for that is a decrease of 6.3% total. All right, next is in attendance, 72,110. The increase you see there in line item 162, clerical position, this is the half-time that we will pick up next year. And let me explain how important that was. Just here in April, when we got our estimates back on our at-risk population, we were about 9,000 off in terms of our at-risk population, which means we were going to be reduced in funding. This was in that department. We're able to not only recapture that, but also recapture some that we didn't know we had. So that's been that's paid off well for us. All right, moving on down to line item 499. This is additional layers on our student management system, Skyward, that we'll be using to do online registration and things of that nature. All right, moving on over to the next page. Function 72,120, health services, the line item 189, 22.9% increase. This is your CODA, your therapists, your occupational therapists, assistants that were added for the number of students that are in the special ed POP. And moving to the next page.
Can I interrupt you just a moment?
Mm-hmm.
189, you said is occupational therapist?
Mm-hmm. Additional to.
Yeah, that
Assistance.
it would be nice if in future things that was actually listed as occupational therapist, because I have a problem with other salaries and wages when not knowing what it is. So, you know, if we know what it is, if we could put it in parentheses. When I see other salaries and wages, and I don't have any foggy idea, then I get scared.
Yeah, we can do that.
Yes, well, we can give a breakdown.
Right.
But the reason that we use that, and I agree with you, that it would be
Well,
nice.
it shows up a lot, and I you know, it may not be possible in some places,
Well,
but if we know it, it would be
And
nice
that's kind
to
of
see.
like why we're kind of going over some of
Right,
this.
so I'm not being critical, I'm just saying it would be
I got
helpful
you.
information.
This is in the uniform chart of accounts, but I see what you're saying, but we have to put it in the line item that the state tells us to.
Right,
Yes,
Well,
we can
yeah.
get you details.
We can
Maybe
get the
just
detail.
parentheses.
All right, going on to 72,130. Yes. Mhm.
Could we get Mr. Bodery, maybe sometime later on in the week, all of these highlights that you're
Yeah.
pointing out?
Yeah, we can do it.
Give us a line item list.
Yes, we can do
and
that.
email it to us and then
You have that. You already
explain to us.
Yeah.
Yes, sir.
Yeah, we can get you one.
Madam Chairman,
Yes.
if I could ask the commissioners using they use their mic. I can't hear when they don't use the mic.
Very good. We'll do that. I'll remind them. Thank you.
All right, 72,130, other student. The first one there is 72.2% increase on the supervisor and director. What we did there is our safety school supervisor. The state had it roll over to this line item. This line item here includes the safety supervisor, our athletic, not our athletic trainer, but our head of athletic trainers, and also our part-time district AD. So that's their 2.5 positions there. Okay. Moving on down that page, looking at the PR benefits in subtotal there in 370, a reduction of 45.5%. On the non-sub certified, those are the ones that, you know, are paid extra. for having having a certification. This year we changed our vendor. We had less of those, and obviously this will be some savings also as with schools shut down. The next item is other contracted services. This right here, you have to help me out here, Doug, on this one right here, on the 399. All right, the trainers, MTSU trainers that we segued away from to other our own personal trainers, and also some that's been funded through TOA. All right, the total for that function increased with 1.4%. All right, moving on over to 72,210. I think we've already talked about 138. That was that moving of those, repurposing of those instructional technology coaches back into instructional coaches. Excuse me. All right. I think the rest of that there is pretty self-explanatory. Most of this is some reductions. In the final total, I think was for the 72,110 is a decrease in 23.4%. All right, next, object code, alternative instructional program. I think that one there, like, once again, I don't think there's anything that's earth-shattering on that one. You can see the budget increase is 0.4 of a percentage point. Moving on to 72,220 special education program. All right, this the big one there in line item 189, other salaries and wages. The big one there is the special ed assistant tech that we've had to hire. We'll be hiring. You know, one of the things in special education, I think we all know that this is a really challenging area. Some of our students are, have some severe challenges, and in order to maintain their IEP, making sure that we're doing everything and providing services that we have to be providing, it requires a lot. Moving on down there, you can notice even with this, the total decrease in this one was 2.8%. Going over to the 72,230 career and technical education. The huge line item, excuse me, the huge line item that kind of sticks out is the 524 in service staff development. In our career technical education classes, at the end of the year, or some toward the end of the year, they have to compete in different facets of their program. That's to complete their program. This line item here that is for the teachers who have to go and chaperone them and be part of the judges in this program. As we add more and more career and technical education classes, this will increase because they do have to compete in those areas. The total increase for this budget item, for this function, is 13.7%. All right, next is technology. 72,250. The big one here, and I'm going to ask Doug to talk about this one here, is 399. The 67.7% on the line item 399. Go ahead.
That's just additional contracted services for technology, for like internet connectivity and other things for instructional items.
All right, the rest of them, other equipment, total increase of 6.6% from that object code. Next is our adult program. That's pretty self-explanatory there. A 2% increase on the previous fiscal year. Next is the Board of Education. 3% 331 is the one that kind of sticks out, an increase in 12%. This is to provide billable hours to our legal staff in order to address our special ed concerns. We've got one staff attorney, and she's pretty inundated with a lot of things without the SPED, so we're looking at an attempt to try to take some of that off of her. The total.
Excuse me.
Commissioner Gurley has a question.
I have a question. This is for this budget is the Board of Education budget, right?
Yes.
Looks like we're increasing medical insurance by 300,000. How many members of the board do we have?
Which line item are you talking about?
207.
Okay. This includes everyone that works, is that not?
That's the, yeah.
7.6, a 7.6% increase? That's everyone.
But not everybody.
That's everyone in our, is that everyone in the central office?
No, sir. It's those that fall in. But it's not, we're not giving Board of Education. No, the Board of Education does not get health insurance. That's not.
I think what he's asking is the increase, the budgeted amount,
Yeah,
3
I'm
million.
just trying to figure out who that covers, the medical insurance. Is that all the employees, 300,000 more, or?
3,626,000,
Yeah.
268.
No, that's not.
207.
Let me get back with you, sir.
Okay.
It'd have to be, yeah, that's what I thought.
Yeah. I mean,
Everybody.
I'm just trying to figure it out.
Yeah. We'll get back with you.
Okay, thank you.
All right, 320. That's a 1.1% increase on that object code. All right, the next one is 410, the principal, office principal. The one that sticks out there is the 15.4%. What this is primarily what we've had in the past in our elementary schools is the secretary was the attendance clerk, was the secretary, was the part-time guidance counselor, and you name it. In order for us to make sure that our ADM is correct and this attendance is being taken correctly, what we're adding is what we're doing is taking some of these and making them 9 exactly, we're building in there and making them complete attendance and guidance clerks instead of having to do all the other things, because this does would cost us in the end if our ADM was not correct.
Can you explain the 3 assistant principals since we're not adding schools this year?
It's growth for coming up for next year. Our growth that we're projecting for next year. We're already at, those 3, some of them, it's not 3. What we would do, like, for example, there's some that are half-time that work at school A and then work at school B 2 days and reverse it. With the projected growth of them rolling over, we're already looking at projected growth. That's going to require a full-time. So that's what we're doing. Okay, the total increase for that is 4%. Next is 72,510 fiscal services. All right, the 399, actually, yeah, the 399 is the one that kind of jumps out at 38.8%. This is the automated time key. And of course, when we look at this, I know Mr. Beaudry talked about this in terms of making sure that we're holding, we have some internal controls, but also keep in mind that there's a lot of paperwork that's being passed around in his office. And, for as large as we are, that can really take away from or add to one of his workers who could be doing something else that they're actually being paid to do. So if we're, the first end, I guess I always look at the return on investment. We will get a lot more return on this investment for this cost. The total increase for the 72,510 is 5.3%. All right, this is human resources, 72,520. The big one is the other contracted services, 399. That's an 89.4%. This is for our software, recruiting software. Anything you want to say on that, Doug?
Basically, just enhanced. It's an enhanced system that, especially a certified staff, with so many teachers retiring, of our older teachers retiring, and just an attempt to try to bring. I'm sorry. It's with what this software does is it's contracted software that our human resources department has identified that with other systems using this software and contract service successfully to recruit, especially certified staff, meaning teachers, as we have more and more of, and I guess it's like in most industries right now, as you have a lot of workforce aging out and you're competing with other districts, to get quality teachers, they've noticed that they've had success in other districts with this type of, contracted software to recruit, recruit most of the employee types we have, but mainly we're after those teachers.
Yeah, one of the things too, when we're talking about recruiting, we're talking about recruiting experienced teachers. MTSU puts out about 100 student teachers a year, and a little bit less in the spring, and it's not like it used to be, so the recruiting is a viable tool there. The next one, the operation plant operation 72610. The big increase there is other contracted services, and what this is budgeted in for, help me out here, Doug, is this this is not the schools, is it? Yes. Is it budgeted in for the schools? You may want to talk about on some of that, because I know they send in a request every year.
Every year we send out a request to the principals. We send out technology requests, things that they need for their school, technology, financial, cafeteria, maintenance, capital projects. We get those lists back. Myself and my department, we spend about 2 months poring over them, going to the schools, reviewing them, looking at them. These are the funds of things that don't fall into capital projects but still have to be repaired. If you were to, and I'm going to use Oakland High School, if you go to Oakland High School now, they've had the schools built in '72. They've got round concrete columns. They've got 3, it's a walkway, but it's a concrete walkway, and it steps different heights. That concrete is internally drained. Over the years, that piping is cast iron, has deteriorated over the years inside that concrete. So what happens? The water starts leaching through the concrete. They're structural in nature, and now that concrete's beginning to spall and come apart. Well, we have to repair those kind of things and take care of them. Some of them are $10,000, $15,000. And a lot of it is not things that our maintenance staff is either skilled enough or has the time to get to. So we contract out, and I'm not being flippant because I see it all, $10,000 here, $15,000 over there, $20,000. So these things have, as our buildings have aged, for some reason this year we seem to have had more requests. And that's not all of the requests. So the increase, that's what the increase is for. It's basic maintenance to take care of different things at all of our schools.
All right, the next one there is the other supplies and materials. This is all school related, taking in consideration all of our 47 schools. And the total increase for this object code 72610 is 4.7%. Okay, going to the 72620. I think we go down to the line item 701. That's the largest one, and that is our school safety. Our school safety things that will be purchased. Can you kind of give us an idea of all what we're going to buy with that?
What that is it's, we each year, we apply for a school safety grant, state grant funding. And we, at this point, as we're developing the original budget, we don't know exactly what we're going to get equipment-wise. We have some payroll that is funded through that grant. Our school safety director and one other person assistant, we go ahead and budget it in the original budget for that payroll. And then when we get the actual true amount, the exact amount that we're going to get in that grant for the equipment, we'll come back to you like we did this year, and yes, and then get an amendment, and that'll go up to what we get dollar for dollar on that grant.
All right, moving on over to 710 transportation. All right, big increase there. Contracts with vehicle owners, 12.8%. This not only includes new routes, but this also includes a 5% raise. $399 other contracted services. This includes our Edulog system, which maps out our routes. Having to reconstruct that and add. How old is that system?
Somewhere between 10 and 12 years.
10 and 12 years, and we're having to add more layers to it.
Well,
Get up here and talk to us about it.
the short version of the Edulog routing system is as you add routes, they add layers. And it's like a lens on a telescope. The more it works real good with one lens, but if you start stacking those lenses, it starts getting blurry. And we've been stacking for years with this system, putting Band-Aids on it, adding layers and adding layers. And it's got to the point where we're paying Edulog this year to tear it down and rebuild it. So that's where the additional funds is coming in this year. We're having to rebuild the whole route. Yes, sir.
I was going to ask about 315.
Okay.
Yeah, that 315, that was,
That you're proposing a 5%?
yes. The board requested that we build that in, a 5% raise increase.
They got 5% last year as well, didn't
Yes,
they?
sir. That's correct. All right, the next one is 701, the administrative equipment. This is for the two-way radios that we purchased. You know, if you've ever tried to listen in at the transportation department there in the mornings and the afternoon, it's like, I don't know what, it's not good. And a lot of them are depending on cell phones, and this is also an issue. The increase total for that object code is 2.7%. Okay, the next few pages are pretty zeroed out. Let's turn to 73,400. Yes.
Telling me that they're using cell phones, which is against state law.
Not when they're driving. Okay, they can't do that. All right, the next one is 73,400, the preschool program. The big one there is the 30% for travel, up from 500 to 650. Doug, I don't have a clue about that one, brother. What's travel? What travel are we talking about?
The travel on the pre-K, that's just local travel, that if they had a supervisor that was going from one of the pre-K sites to the other, that would be just for mileage reimbursement for just some de minimis travel that's in the county.
Just while we're on that, one of the things that we did do and will be doing is that we'll be repurposing John Coleman Annex, and we will be moving some of our pre-K, about 220 students. I think that's what it is, 220 or 240? 240? 240 students there. They'll be coming out of some of our schools that are at capacity now, and we'll be opening up, in our elementary schools, we'll be opening up more space. So that's one way we'll be able to take advantage of John Coleman Annex.
Mr. Director, y'all must have done some real improvement over the last couple of years, because I can remember walking through that building with Miss Haley before John Coleman, the new structure, and it was in rough shape. So you've been busy, I suspect.
Well, we'll invite you out there. I was very surprised too. I'll be honest with you. It's nice, very nice. Our, the Head Start was there. We needed the space when we moved, and I think the Mid-Cumberland went under, did they not? So it was taken over by another entity, but we needed the space. We bounced around several different ideas, and it made more sense to move our pre-K there. And what we'll do is it'll open up some rooms, especially in our northern end of the county, like some of our schools there. It'll open up some space for them. Yeah. But it's nice. I invite you to go see it. All right, the total on that increase is 5.4%. The next one is, 0. And then, of course, debt service, you can see that. And debt service interest. And 99,100. Now we get to the back page. When you total all this up for 2020, 2021, we're adding 5,087.7 in terms of what's allocated. It's not really staff, but it's all the components that come together. The grand total is $427,957,837. That's a 2.4% increase. That is approximately probably around $10,175,458 more than this year's budget. Doug, you want to say anything?
Give us the growth rate as far as student growth rate.
We're setting. That's a great question. Actually, our growth rate is the same as that increase, 2.4%.
Okay.
Any other questions?
Just don't know how it worked that way.
This guy here, he right on the. I was almost left that out on you. I'm glad. Thank you, Mr. Gurley, Commissioner Gurley, for asking that question. Ma'am, we're over 1,000. We hope we don't have many more over 1,000. Ooh, that's enough for us.
I know that's a lot of information to take in. And so what I encourage each of you to do is to take your time over the next 30 days, really dig into it. If you have any questions, please reach out to central office or to Lisa. Let's try to get as many of those questions answered in advance of next month's meeting, because it is a large meeting. It's an important meeting. I want you to come prepared and confident about the vote that you cast. So please make sure that you do your due diligence in the next 30 days.
One other thing, we will get you that breakout. We can't change that in a line item, but we can get you what that represents. Yeah, we can do that.
Justify what we're
Absolutely.
spending. Madam Chairman, maybe the mayor can answer, or you may can. Will we be voting on a commissioner in May to replace Commissioner Irvin? Will we have 7 members back at our May?
No, sir, Madam Chairman. Steering committee next week will be at their next meeting, whenever that is. We'll be making a recommendation for someone to fulfill until the next election. August election. They will serve until that period of time. Talked to Alan Farley. He will be taking, applications that have to be turned in by the 15th of June for those who want to be on the ballot for the June 12th, that have to turn it in and be certified, and they'll be on the ballot for the August election.
Right. What I was wondering, would we have an appointed replacement?
Steering committee will do that.
And we would vote on it at our May meeting.
Correct.
On
Yes,
that
sir.
person, So we would, on our 26th meeting with the school board, have 7 members on the.
I've only had one person step forward that I've talked to that's interested and only would be willing to serve in that period of time for those 2 months only. They don't want to go any further, but former chairman of the Finance Committee, Joyce Ely, has expressed that interest for serving for 60, 90 days, whatever that may be. Okay.
Any questions for school board? Very good. Thank you very much. I appreciate your thoroughness. Okay, so to remind everyone, our May 26th meeting is at central office. It is at 5:30. It's the joint meeting with budget and school board. It is a health and education meeting. We will be the only folks who are actually casting votes. Anyone can ask questions, but it is our meeting and we will be the only voting members. Our June meeting is June 22nd at 5:30. If you remember, we had to move that. We always have to finesse that June date a little bit to get everything in time for us to set the tax rate and have that daytime meeting. So make sure you have it on, so our next 2 meetings are not normal for us. So in May, we're at a different location, and in June, we're at on a different day. Is there any more business for this committee? Mayor?
One last comment, Madam Chairman, members of the committee. I know it's a few hours premature, but tomorrow, Ms. Nolan turns 39. So happy birthday in the future. So sing with me. Happy birthday to you. Happy birthday to you. Happy birthday, dear Lisa. Happy birthday to you. 39 and hanging. Now, Max said plus 20. He sent me out a text. He said, no, plus 20.
Yeah, that's the 20 years that Mac put on her, so she didn't have those without him.
Happy birthday.
All right, is there any more business for this committee? If not, we are adjourned. Thank you.